as well as create visibility for those affected, sometimes just as important. Joining me now live is the Midwest and East Regional Clinic Director of the Eating Recovery Center, Dr. Ellen Astrachan-Fletcher. Doc, thanks for being with us this morning.
Thanks so much for having me.
So let's talk about all of this. Mental health illness, eating disorders specifically, are complex, and unfortunately they can be misunderstood, they can be oversimplified, particularly in the media where we're trying to narrow things down in a short amount of time. From where you sit, can you explain to our viewers how exactly an eating disorder is diagnosed?
Well, an eating disorder has lots of symptoms, and I would say the first thing for someone to be diagnosed with an eating disorder is they have to come to an assessment, which, by the way, at Eating Recovery Center, we do for free with no commitment with a clinician. So you need to encourage a person, if you're concerned that someone has an eating disorder, to get an assessment. And what signs that you're looking for are emotional signs. You might see someone isolating more, withdrawing, having kind of angry outbursts, really kind of following rules about food, about exercise, really, kind of both physical as well as emotional.
So an eating disorder can look different in every person after they get that assessment. Can you talk more about how eating disorders can impact, though, anybody, really? This is not a race, a gender, an age thing, right?
Absolutely. Eating disorders do not discriminate. They can impact anybody. From very young, I've seen people as early as ages 4 or 5 being diagnosed with ARFID, to extremely old, into their 80s or 90s. People of all genders, people of all races. Really, eating disorders do not discriminate. And full recovery is possible, which is why it's so important to have Eating Disorders Awareness Week.
Yeah,
right?
And conversations like this one, right? Absolutely. Now, the CDC released a study last year showing emergency room visits for eating disorders doubled for teenage girls during the pandemic, a really stunning number. And then just last month, another one of their reports shows teen girls are experiencing increased sadness and violence. What factors are contributing to this increase in mental illness, specifically when we're talking about younger girls?
Right, absolutely. I mean, I think it starts with the pandemic, because that's when we really saw the shift. And the pandemic really kind of fosters this isolation and secrecy that mental illness feeds off of. Human beings are social by nature, and we need each other. And when we can't connect in person, it negatively impacts us in a very big way. And also, people were in front of the screen all the time and continue to be in front of the screen all the time. And social media, while it also gives people a way to connect, although a little more superficially, really can put out messages that can be very damaging to those who are vulnerable.
So if someone is struggling with an eating disorder or knows someone who is, what are the best first steps to take? What are some tools people can take from this conversation, some resources available?
Absolutely. Talk to them first. Be honest and don't be judgmental. Explain what you're seeing and express your concerns, and really encourage them to get help. That's the biggest thing, because the sooner one gets help, the more likely recovery is possible. So, and we know that we've seen that in research. So, for example, on our website, eatingrecoverycenter.com, we have lots of resources, including free support groups, and encourage them to get an assessment.
Great advice. Dr. Ellen Astrachan-Fletcher, Midwest and East Regional Clinical Director of the Eating Recovery Center. Thanks so much for spending some time with us. Appreciate it.
Thank you for having me.